I'm here today with Dr. Brenda Gorman, Assistant Professor of Speech-Language Pathology at Marquette University. Dr. Gorman is also the Advisory Clinical Director for LinguaHealth. Brenda, thanks for coming out today to talk to me about speech-language pathology issues.
Thanks for having me.
So Brenda, what is it like for graduate students working in a graduate school clinic?
There is a lot of planning. Our students do spend a lot of time planning intervention and, of course, working with the clients in the sessions. Students have to develop a semester therapy plan, essentially mapping out what do I want the client to accomplish this semester, what are their long-term goals, short-term goals, and how they think they're going to achieve some of those goals. Their daily lesson plans map out what they're going to do each session. So thinking, what do I want the client to achieve today? What are some of the strategies I'm going to use to help them do that? And then what activities I'm going to use to support, to provide a context for working on those skills. And after sessions, of course, writing follow-up notes for what the client did, how you evaluate their performance, what your plan is for the next time.
How do you think graduate students can help prepare themselves for the tasks or the time when it comes for them to actually service clients in a university clinic?
It's a good idea to observe, and in fact, ASHA does require that students observe a number of hours before providing the services themselves. And I see some students kind of looking at the task, oh, I just want to get my 25 hours done. However, it's also helpful if you can maybe spread out the hours. Use that as an opportunity to observe different clinicians, different types of cases. That'll give you a richer background for when it's your turn to serve clients. Students can shadow clinicians, even if it's not necessarily for those specific 25 hours of observation. When you get your client assignment, you can do some research looking at past assessment results, therapy plans, what worked, what didn't work, how did the client respond to certain things. And now a lot of clinics have video cameras such that there might be recordings of clinicians working with those clients from past semesters. And I think that would help if you knew this is going to be my client. I'm going to try to watch a couple or perhaps certain segments. I think that would help clinicians feel much more at ease, know their clients a little bit more before they have to see them the first day, and again, giving them an idea of how intervention went. And of course, preparing, going back to your notes. I know a lot of students, we're sort of trained to take that exam and yay, we're done. Okay, out of my head. But I do recommend trying to try to keep the information as fresh as possible. It's a lot of information, but that information will come back and it will be useful for you later on in clinic. So again, when you get your client, go back to your class notes. What is it you learned about the disorder? What is it you learned about those interventions? Looking back at your readings, your textbooks, and as well as looking at some new information. It may have been a couple of years.
Brenda, university clinics are part of the community, so usually there are a lot of unique cases that come in and a lot of interesting clients and issues that we learn from in the clinics. Maybe you can share with us a little bit about what you've seen in your university clinic.
We see a good variety. We try to give students a background in a variety of disorders. So we also see clients with quite a variety. Children with developmental disorders, speech and language delay. We see adults with neurogenic disorders. We have an intensive aphasia therapy group. So rather the traditional model of seeing clients once or twice a week, in this group, clients are seen intensively for 3 weeks with very good results. We see clients with fluency disorders, voice disorders, clients with AAC needs, clients with hearing impairment, sometimes on occasion clients who want to improve their accent. So a good variety of cases.
And how is it that a lot of PhDs, they're working in the clinic, do they ever get to service clients? Do you get to pick some clients that you'd like to work with to stay sharp on your clinical skills?
Sometimes I typically consult with the bilingual cases, which I love, of course, because it does keep me abreast of what's going on. Other than that, it really depends on the program. Some PhD's clinic is one of the responsibilities, and in other programs, such as the Research One universities, where the focus is really on predominantly on research that's typically not a responsibility that the PhDs have. So it all depends on the program there.
Thank you very much for coming to LinguaHealth's offices today to talk about speech-language pathology issues at the university.
My pleasure. Thanks.